Good morning, I'm here today with Emma.
Morning.
Morning, and we're kind of creating a bit of a Christmassy vibe here with the poinsettia and the little snowy men thing I got in Lapland. Are you feeling it?
I'm feeling it.
Yeah?
You're not doing a tree? No tree?
Not yet.
Not yet?
Not yet.
You're
I have
leaving it
my
late.
a nice one in Jamie Aston next door, so yes,
Okay.
watch this space for the next videos. Today, I thought I would talk about what was on my mind this week, which is hair loss.
Yeah.
Because I think a lot of people don't know dermatologists look after hair loss.
We do. Hair is just an extension of your skin.
People go to trichologists for hair loss. Naturally.
I love a trichologist, but I think we all have our different strengths and weaknesses. So I think people don't realise that actually dermatology is about hair. So it's about skin, hair, nails, all of those sorts of things we do. And I agree with you. I've had lots of my patients asking me about their hair and why their hair might be falling out a little bit more than it otherwise should be. So we thought we'd do a video on that today.
So I think the commonest scenario I see is someone who's complaining of thinning on top and maybe a little bit of something changing around the hairline, but mostly it's that they can visibly see increased hair fall.
The shedding. So when you brush your hair, when you're in the shower, people, and it's so scary, I know it, clumps of hair in your hairbrush or in your shower. And I think that's a very common one. Like you say, a little bit of thinning on here, a little bit at the front. But if you are noticing any other unusual patches of hair loss, so sort of circular bald patches, anything like that, definitely it's a doctor thing. So go to your GP or your local dermatologist, because those sorts of things are just slightly different, and that's not what we're talking about today.
And can be quite serious, so it's worth getting an opinion to make sure it's not something that's going to cause permanent hair loss.
Exactly.
But no, the kind of hair loss we're thinking about, when I hear that story, obviously you're going to examine the patient, but I think the first thing to think about is what they're eating. It's so common nowadays for people to exclude certain things from their diet, and diet has such an important part to play in good quality hair, skin and nails. So what do you ask? So
I start off by asking people what they're eating and making sure that they're eating enough protein. And there are certain types of protein. So there's something called a first class protein, which is things like meat, eggs, fish, and they've got all the building blocks that you need to actually make your hair. Whereas other things like proteins from vegetables or pulses, they sometimes don't have all of the building blocks contained in one aspect. So I make sure that people are eating a decent amount of first class proteins every day to make sure that they're optimising their hair growth. Yeah,
excellent. I would next tend to ask about iron, getting enough iron from dietary stores. If people are skipping green leafy vegetables for whatever reason, it can often be really difficult to get enough iron from the diet to maximise hair growth.
Yeah, so iron supplements and checking your iron, making sure that you're optimising iron in your diet, all really important. So I definitely do proteins, iron. The other two I like are zinc and biotin supplements.
Yeah, so I completely agree, and I think they make a tangible difference, certainly in my experience. And I think in general I try to get those sorts of ingredients from food. Let's eat your vitamins where possible, and nuts do tend to be a tremendous source. Almonds, great source of biotin naturally. And cashews and walnuts are great for zinc.
Nuts generally excellent for your hair, for your skin. So I think the other thing to remember though is that it actually takes quite a long time to see a difference. So your hair cycle, from when your hair actually starts to grow to when you get fully sort of formed hair, actually takes a little bit of time. So I say always wait at least 3 months before you're going to notice a difference. So you really have to keep going with those sorts of things, unfortunately.
3 months is a pretty good number for most things in skin, hair, and nails. It does take time. You need to have a belief system in place that you're doing the right things. But yeah, so I think there's a good things to start with. Hormones. We do know that hormones have a role to play in hair loss. So I think it's always important to take a history and look at contraception, recent pregnancies and what their cycle is doing, because sometimes that does need further investigation.
And from our perspective, we see sometimes people who have hair loss associated with acne and their periods might be a little bit irregular, and then we're starting to think about something like polycystic ovaries. So again, if you do have hair loss in the context of anything else, then it's always really important to have that checked out.
Yeah, absolutely. What can we do?
So diet, huge aspect, and then supplements if necessary. But the other thing I sometimes see is, like you were saying, a little bit of thinning here and sometimes in the front, and you might have somebody that's got quite a lot of hair loss within the family as well. And then we start to think about sort of female pattern hair loss, where women are losing their hair in the same way that men can sometimes do with male pattern hair loss. And for that, I often advise minoxidil, which is actually a really, really helpful product that you can buy over the counter.
And it's far more common than people think.
It's really common.
I think it's often revealed by other things in the first instance. So pregnancy comes along, you have increased hair fall, and then it never quite goes back to where it was. So I think you get perhaps an acute instance, often making you present earlier than you might otherwise do, and revealing where your genetics were going to take you.
Exactly.
And I think it is important to get in early with something like minoxidil, which is a proven treatment which does help preserve hair growth and maintain luster and volume.
But I think something that you said about getting in early, and I think for hair that is one of the most important things that you can do. Because actually sometimes when the hair's actually gone, then it's more difficult to change things around. So actually the earlier you get in, the better the result. So there are lots of things you can do for your hair. So if you're noticing that you have reduced hair or thinning hair, then it's definitely worth getting checked out.
Then just a final note, expensive hair supplements. What do you think about those?
Well, as we know, we're not fans of expensive non-proven things. So I think there's a lot of, I think some of the supplements are very good. You can have one of your all of your supplements in one pill, but I think often a lot of the treatments out there are not evidence-based and they're not really going to help. So choose your product wisely, I think. What do you think?
I think so. I personally prefer a more reductions approach where you get your biotin in one, maybe your zinc in another, and iron in another, rather than a combination therapy which is often not optimised for the correct dose of that particular micronutrient.
Yeah.
Do you agree?
I do agree.
Okay, so basic, know your ingredients, and get good value for money and get your hair back in tip-top shape. I think that was good.
Yeah.
Bye for now.